Congratulations, Mama. You're in the home stretch. You're probably feeling a mix of excitement, nerves, and exhaustion. Let's be real. You are so ready to meet your baby. Every twinge makes you wonder, is this it? Labor is beautifully unpredictable. Your story will be uniquely yours. No two labors are the same. There's no crystal ball, but understanding the signs can help you feel more in control. Today, we'll break down the most common signals your body sends when labor is just a day or two away. We'll separate fact from fiction and give you the confidence to recognize what's happening. So, take a deep breath. This is your guide to the final countdown. Let's start with the classic movie moment, the water breaking. You've probably seen it 100 times in films. A pregnant woman gasps, clutches her belly, and suddenly there's a dramatic flood on the floor. Everyone panics, and chaos erupts as they rush to the hospital. But how true is this Hollywood version? In reality, it's often much less theatrical. For most women, the water breaking is a slow trickle, not a dramatic gush. Sometimes, it's so subtle you might even wonder if you just had a little accident or if it's something more. What's really happening? The amniotic sac, which has cushioned your baby for months, ruptures and releases clear, odorless fluid. This is your body's way of signaling that labor is approaching, but it doesn't always mean you'll be holding your baby in the next hour. If you're unsure whether your water has broken, here's a simple trick. Put on a clean pad and lie down for about 30 minutes. This helps the fluid collect, making it easier to notice any changes. When you stand up, if you notice another small gush or more fluid, it's a good sign that your water has indeed broken, rather than just normal discharge or urine. Pay close attention to the color and smell of the fluid. It should be clear and odorless, almost like water. If it's anything else, that's important information for your provider. If you see green or brown fluid, or if there's a foul odor, call your healthcare provider immediately. This could be a sign that your baby has had a bowel movement in the womb, or there's another issue that needs attention. Don't panic. Most of the time, everything is just fine. But making that call is the best way to ensure you and your baby stay safe and healthy. After your water breaks, labor contractions usually follow, but not always right away. For some, contractions start within hours. For others, it can take longer. Every body is different. Once the sac is broken, the risk of infection slowly increases, since the protective barrier is gone. That's why your provider will want to check you soon, even if you feel fine. Stay calm and take note of the time your water broke, the color and amount of fluid, and any other symptoms. This information helps your doctor or midwife make the best decisions for your care. There's no need to rush out the door with sirens blaring, but don't ignore it either. Take your time, gather your things, and prepare to head to your birthing location. The water breaking is a definitive sign. Your baby is officially on their way. It's a moment of excitement and anticipation, signaling that your journey to parenthood is about to reach its most incredible chapter. Remember, the Hollywood version is designed for entertainment. Your experience is unique, and it's perfectly normal if it doesn't look like a movie scene. Whether it's a dramatic splash or a gentle trickle, it's your body's way of telling you, get ready, something amazing is about to happen. Listen to your body's message, make the call to your provider, and calmly prepare to meet your baby. The countdown is officially on, and you're about to start a brand new adventure. Next up, let's talk about losing your mucus plug, a moment often called the bloody show. This is one of those signs that your body is getting ready for labor, and it can be both surprising and reassuring for many expectant parents. The mucus plug is a thick, jelly-like substance that has sealed your cervix for months, acting as a protective barrier to keep bacteria out and your baby safe inside the womb. As your due date approaches and your cervix begins to soften, thin out, and open, this plug is naturally dislodged. For some, it comes out all at once, while for others, it may be released gradually over several days. What you might notice is a glob of mucus on your underwear or toilet paper. It can look clear, yellowish, or be tinged with pink, red, or brown blood, hence the name bloody show. This is completely normal and expected. Seeing this is a positive sign that your cervix is preparing for delivery and your body is making progress toward labor. It's a milestone that many women look for as a sign that things are moving forward. However, losing your mucus plug doesn't mean labor will start immediately. For some, contractions begin within hours, but for others, it could still be days, or even a week, before active labor starts. There's no need to rush to the hospital just because you've lost your mucus plug. The only exception is if you notice heavy, bright red bleeding, which could signal a problem and should be checked by your healthcare provider right away. If it's just a small amount of blood-tinged mucus, simply make a mental note or jot it down. It's helpful information to share with your doctor at your next appointment. Think of it as your body's opening act before the main event of labor. It's a sign that your body is working exactly as it should. Some people never notice losing their mucus plug at all, and that's perfectly okay. Every pregnancy is unique, and not everyone experiences the same signs. If you do notice it, take it as a reassuring sign that things are progressing in the right direction. Share the moment with your partner or support person. It's one more step closer to meeting your baby. The stage is truly being set for your baby's grand entrance. Now is a great time to double-check your hospital bag, review your birth plan, and make sure everything is ready for the big day. The long wait is almost over, and soon you'll be holding your little one in your arms. Every sign, every change is bringing you closer to that incredible moment. Here's a surprising sign. Your weight plateaus or drops a pound or two in the final days. Don't worry, your baby is still growing. This is due to hormonal changes, less progesterone, more prostaglandins, and your body shedding excess fluid. You'll notice more frequent urination and maybe less swelling in your hands and feet. It's a subtle, quiet nod from your body that labor is near. The weight loss is minor, just 1 to 3 pounds. It's not a sign to act on, but it's a fascinating indicator of the hormonal shift. Your body is streamlining for the marathon ahead. If your shoes suddenly fit again, take it as another piece of the puzzle. The main event is getting closer. Suddenly scrubbing baseboards at midnight? That's the nesting instinct in overdrive. It's a powerful, primal urge to prepare your space for your baby, often just a day or two before labor. One minute you're exhausted, the next you're organizing the pantry or assembling baby gear. This burst of energy is nature's way of prepping you for childbirth. Channel it into light, productive tasks. Don't exhaust yourself. Delegate the heavy lifting and focus on what matters most. If you're alphabetizing the spice rack at 2 a.m., pause and redirect that energy. Pack your hospital bag, lay out the baby's outfit, or write a letter to your baby. This instinct is your mind and body working together, preparing for a monumental change. Embrace it, but be gentle with yourself. The finish line is just ahead. Your nest is almost ready. Labor is near.
Know you've been a good friend.
Back pain is common in pregnancy, but pre-labor back pain is different. It's a deep, persistent ache in your lower back that doesn't go away with rest or position changes. This pain is often caused by your baby dropping into the pelvis, putting pressure on nerves and bones. Sometimes it's the start of contractions, especially if it comes in waves. The hormone Relaxin is loosening your joints, adding to the ache. The key difference: this pain sticks around no matter what you do. It may wrap around to your hips or radiate down your thighs. If it's new, deep, and persistent, pay attention, especially if it's paired with other signs. Try timing it. If it has a rhythm, it could be early labor. Your body is making major shifts to bring your baby into the world. The big one, contractions. For every expectant parent, this is the moment you've been waiting for, but also the one that can bring the most questions and uncertainty. But how do you know if what you're feeling is the real deal or just another round of Braxton Hicks, those so-called practice contractions? Braxton Hicks contractions are your body's way of getting ready for labor, but they're not the main event. They're usually irregular, infrequent, and often disappear if you change positions, move around, or simply rest for a while. These practice runs feel like a gentle tightening or squeezing of your belly. They're not usually painful, more like a mild discomfort or a firm hug from the inside. True labor contractions, on the other hand, are a whole different experience. They're not just uncomfortable, they can be intense, and they don't let up with movement or rest. As labor progresses, these contractions become stronger, last longer, and come closer together. You'll notice a clear pattern emerging, and the intensity will keep building. They don't stop, and they demand your full attention. Use the 5-1-1 rule as a guide. Contractions every 5 minutes, each lasting 1 full minute, and this pattern continues for at least 1 hour. This is a strong sign that labor is truly underway. True contractions often start as a dull ache in your lower back and then wrap around to the front of your belly, creating a wave-like sensation that's hard to ignore. At the peak of a strong contraction, you may find it impossible to walk, talk, or focus on anything else. This is your body's way of telling you to pay attention. Start timing them. Note when each one begins how long it lasts, and how close together they are. If you notice the contractions are getting more intense, lasting longer, and coming at regular intervals, you're likely in active labor. Don't be discouraged if at first the contractions are far apart or not as strong. Early labor can take time, and it's all part of the process. Use this time to relax, breathe deeply, and gather your strength. Early labor is your body's way of preparing for the big moment ahead. With each contraction, your uterus is working hard to open your cervix, making way for your baby's arrival. Think of Braxton Hicks as the warm-up, your body's rehearsal for the main event. True labor contractions are the real show, the main event that signals your baby is on the way. When you see that undeniable, regular pattern and feel the intensity building, you'll know it's time to get ready. Gather your things, call your support team, and get ready for the journey to meeting your baby. The anticipation and excitement are building with every wave. The engine of labor is starting up, and you're about to embark on one of life's most incredible adventures. Feeling wobbly in your hips and pelvis? That's Relaxin at work. This hormone softens your ligaments and joints, especially in your pelvis, to help your body open for delivery. You might notice more waddling, achiness, or instability. Be extra careful with your footing in these final days. Relaxin also affects your digestive system, often causing loose stools or diarrhea before labor. It's your body's way of clearing space and preparing for birth. If you feel like your hips are made of jelly and you're making more bathroom trips, it's a good sign. Your body is softening and opening from the inside out. This is a testament to your body's wisdom. Rigidity is the enemy of birth. That wobble means your body is making way for your baby. Suddenly able to take a deep breath? That's lightening, your baby dropping into your pelvis. This relieves pressure on your lungs and stomach, making breathing and eating easier. You might notice less heartburn and more appetite, but you'll feel more pressure on your bladder and pelvis, and maybe more back pain. For first-time moms, lightening can happen weeks before labor. For others, it's just hours before. Your bump may look lower. Friends might even comment, "The baby has dropped." It's a visible, tangible sign that your baby is getting into position. The pressure shifts, but it's a crucial step in the journey. Enjoy that deep breath. It's the calm before the storm. Your baby is in the starting blocks. The descent has begun. Labor is on the horizon. The last month is a whirlwind of emotions. Excitement, impatience, nerves. Every day feels endless, but your body is working overtime. There's no foolproof way to predict labor, but knowing these signs helps you feel prepared. These are purposeful messages from your body. Listen to them. You are strong, capable, and ready for this. Soon, you'll be holding your baby in your arms. You've got this, Mama.